My guest this morning is Professor Johanna Schoen, who has joined our department from the University of Iowa a couple of years ago, I guess it is now. And we are fresh back from a symposium that she organized, which went on for 3 days. And so I'm going to want to ask you about that. But I first want to ask you to tell our students a little bit about the undergraduate courses that you teach. And I'm particularly interested in the one that focuses on film, because our course is about visual things.
So, yes, I teach undergraduate courses. The one on film that Rudy mentions is a class on the history of medicine in film. It's a hybrid course. We basically watch a film a week, and we do this chronologically, in chronological order. So we start with Frankenstein and basically work our way towards the present. The last film we're going to watch is a film called My Sister's Keeper. And basically what we do is we watch these films, and then we talk about what we learn about the way in which medicine and physicians and the relationship between physicians and patients was perceived at any given time period, and how it changes over time, and how medical care changes over time. And there are a number of topics that we come to over and over again. The first one kind of being whether physicians are really mad scientists or whether they're caring physicians. So especially the first couple of films kind of ponder that issue. We talk a lot about the way in which the physician-patient relationship changes. We talk a lot about the impact of technology on medical care, because technology plays a huge role, and a number of other issues. So it's a wonderful course, and you should take it.
Great. Okay, now we're going to focus on this symposium. And so a symposium, according to Plato, people eat and drink, and they
We did that too.
Learn things. What did you hope to accomplish, and what were the highlights of what you did accomplish in the symposium?
Some people don't just eat and drink. They basically do that so they feel well to then discuss. But a symposium is really an opportunity to get people together to have a conversation. And what I was hoping to do, and I think we were successful in doing, is to provide a space where a group of people who never talk with each other are able to have an extended conversation, in this case over about the course of 2 days. And the people I invited were academics, historians, sociologists, anthropologists, some legal scholars, I think a couple political scientists, who are working on issues that have to do, in the broadest sense, with pregnancy, abortion, the way we look at a woman's pregnant body, the way we look at a fetus, and then abortion providers as well as their lawyers, so that we could bridge the divide between people who actually provide medical care and people who kind of study these issues abstractly. And we could also cross disciplines by basically inviting people from all kinds of different fields. This also included a neonatologist, for instance, who came from a major medical center. We had about 26 speakers, and we basically spent 2 days talking about academic analyses that have to do with the way that we understand pregnancy and its implications, and then also the implications of what that means for providing abortion services in today's context.
Now, the students will be watching in full the talk which Jeannie Ludlow gave on the first day, and she's sort of in between. She is a counselor,
Right.
And maybe not a provider in the technical medical sense, but in that stage that comes before the actual medical procedure, and yet she also writes and publishes, and I guess she's a sociologist.
I think she's an English professor.
You're right, that's right.
English and women's studies, I think.
And I was very much taken, and the students will see her talk, but
Yeah.
She introduced for me, which I hadn't really thought about, the notion that those who provide choice are at the troubling end of a spectrum of cultural wars in which the self-styled or named pro-life people are doing very well in influencing the public imagination, and they do it heavily through visual images. They're the winner with those images. The conference grappled with that, the symposium grappled with that.
Yeah, it did actually to a fairly large extent. So what happens is that at the point where abortion becomes legal, which is in 1973, ultrasound sonography does not yet exist in the way it does today, so people don't really have images. But from very early on, one of the things that anti-abortion activists did in a very concerted effort was to basically collect images of fetuses that had been aborted, and to take pictures of those and to kind of weave them and use them for anti-abortion materials. And then once ultrasound developed and the images became better, there was also this notion that you could now look inside the womb. And this led, one of the things that anti-abortion activists have tried to do is basically to redefine the fetus as a baby, and to make everybody believe that a woman who has an abortion is really having an abortion for a baby that is almost at terms. So the images that you see have nothing to do with the fact that 90% of abortions happen within the first trimester, and it doesn't look like a baby, and it isn't a baby. But there's this kind of debate that, you know, emerged in the 1970s and is going very much to today, and that is very much supported by these images in the attempt to make people believe that it really is a baby, that it looks like a baby, that it responds like a baby, that it feels like a baby, that it has consciousness like an adult. So the images are really important for that kind of discourse. And I think there the pro-choice side has had difficulty figuring out how to meet those powerful images. In the early 1970s, when abortion became legal, there were some images of women who had bled to death that were used to kind of provide the pro-choice aspect for this. But I think those who defend the right to access for abortion don't like using it because it seems exploitative. These women, you know, they're dead, they're naked, they're on a bathroom floor. It just doesn't seem appropriate.
Of course, tries to confront that difficult issue with regard to war images as well.
Yeah.
The questions of privacy and taste.
Yeah.
But that doesn't seem to diminish the power of the pro-choice side of things, which blows up 7-foot images of...
You mean the anti-choice?
I'm sorry, the anti-choice. The pro-life side, which blows up 7-foot images of, as you say, sonograms that are at 32 or 34 weeks.
Yeah.
And it substitutes that for 8 and 10-week abortions,
right,
which are radically different. I'm not going to have the students read Thomas Aquinas on when life begins, because I don't think that's as powerful as the kinds of visual arguments that your symposium was grappling with. But I will say that this is an age-old question of when life begins. And do the visual images relate to that? We're going in the other half of this week's work to be looking at some 19th century early photography, and I'm also very interested in the strengthening of family connections that happen. Now people take pictures of babies, newborns in the hospital and shoot them around on the internet and on Facebook to all sorts of...
Well, and people incorporate ultrasound images in their birth announcement, and you know, they show them. I mean, I myself, my son's birth announcement had a before and after picture, so it had this picture of this ultrasound, which really was not really recognizable to the untrained eye, and then it had a picture of him when he was like 5 days old. You know, and he's 21 years old, so
right,
that was a while ago. So, I mean, people routinely go and they get these images when they're pregnant because they do want to develop a relationship and show that picture to their families. So the images can be used for many things, and they have had such a pervasive impact on the way in which we understand pregnancy and in which we try to understand what it means to be pregnant and to carry a fetus or to carry a baby and to figure out whether or not we want this child or not, that you know, that it just has had a huge impact on the debate and on the way we feel about this.
One of the themes that runs through all of the weeks of our course is that historians are not so comfortable with visual evidence. They learned more than a century ago about documents and authenticity, and I always argue that they were forced by the field of Holocaust studies to recognize memory and oral testimony, but that we really haven't gotten very far with visual evidence we fluff up sometimes our books or whatever, but we don't find it as a central driving explanatory force. And yet, in particular, I think that your symposium and the general topic of maternal and fetal imagery explodes this whole notion of what historians ought to be doing. I mean, when as we're writing the history of the late 20th and 21st century, in this field, the visual is enormously important, isn't it?
It is, but I can understand why historians are wary of dealing with visual images because they're so much used for manipulation. You know, I mean, even
doesn't that make them powerful? The word is
it makes them very
used
powerful.
to manipulate. Dante wrote some wonderful poetry
Right.
that we're going to be doing in class in a few weeks.
Right.
That's manipulation.
Yeah, it is. You know, as are, I remember that there were debates, for instance, about the images of Jews who had been killed in concentration camps. And, you know, who, or family members who were still alive were also talking about how exploitative those images are, and nobody asked for their consent to be photographed. So I think there's a lot of really interesting discussion that you need to have and can have surrounding these images. But I think partly it's the complexity and this attempt to stay objective that makes historians shy away from those kinds of debates.
I want our students to think further about why the written word somehow has a claim to objectivity superior to that of the visual, or is it, in this case, the power of the visual, which is telling us we've got to deal with this as evidence. When you use it in your course where you show film on related to medical history, right? I mean, you're on to the visual as a fundamental piece of evidence, no?
Right, certainly.
Okay, well, that's one of the things we want our students to do more with. We're going to have them look at some images which are really drawings of Vesalius in the 16th and 17th century kinds of things, where, of course, they knew much, much less due to modesty and other reasons. But I think we'll mostly let the students cope with that one. I was very interested, little dismayed, but not totally, by how many of your participants really didn't want to be videoed, and I don't think they distrusted me as or my students, but they just didn't feel that was necessarily appropriate to what they do, and they've been the victims of the misuse of photography, no?
Well, and they are on hit lists of anti-abortionists. I mean,
Yeah,
people
I mean,
get killed on a regular
yeah.
basis, and I have people who are, you know, possibly getting killed. So of course they don't want their image taken.
So it's this kind of a very practical sort of identification.
Yeah.
And are you planning to publish in a more traditional sense some of these proceedings, or what will happen with this symposium? Does it have an afterlife?
Yeah, I think it does. I mean, one of the things we're trying to do is to collect all of the contributions, all of the talks that people gave into an anthology, so that we have a written record of what happened, possibly with some images, if we can get the press to do that. But I think there was also a sense that this is the beginning of a conversation, that we have to get this group together again in a couple of years, and that there are other people who we might want to reach out to kind of continue and deepen the conversation. So we didn't, for instance, have anybody who came from outside the United States, and of course there are a lot of international global issues related to this, and part of the reason was that this was the first one and there were financial constraints and so on. But I think, you know, I see it as, this is one of my conclusions from the symposium, I see it as academics, we have the opportunity and hence I think also the responsibility to create those spaces for conversations. And so I think I see it as something that I want to continue to do.
I want to ask you to step beyond the role of historian, and if you're willing, and I can't think of a wiser person on this, to tell us where this is going in 10 and 20 years in the generation of the children of the students that we're addressing now.
What do you mean with this?
Well, the entire pro-life versus pro-choice debate, which I think the pro-life forces are constantly making inroads, and I think that the danger of the 21st century is stepping back from where we were in 1980.
Yeah.
And I'm very troubled about that, but
Yeah.
we historians, we don't predict, we hide behind that, but in fact I'm very interested in where you think.
And I will disappoint you and not predict because I feel like I really can't. I mean, for me, the
Well,
whole...
tell us why then, that's okay, tell us why it's not predictable. I'm interested in this generation of students.
Right.
They're taking this little class, an hour or so that they're going to debate and discuss things.
Yeah.
But they're the ones that count in all of
Yeah.
this. Aren't they going to be the voters who elect politicians who make a difference?
They are, and I think it depends on how you look at this debate. I mean, on the one hand, certainly the pro-life side always makes us believe that these are really questions of life and death that are decided here, and that this is one of the reasons that we basically need to get to a point where we can overturn Roe and make abortion illegal again. For me, though, it's really more a question about women's self-determination and whether we feel that women actually have the moral agency to make decisions about whether they want to carry a pregnancy to term or not. So I look at it much more from a feminist perspective. And I have to say, in that sense, I actually have hope for the future, because I think that a lot of the younger generation, they tend to be about these human rights, civil rights issues much more progressive than older people. So I don't know. I feel like when I look at this back and forth between, we have years where there's such a legislative assault on the right to abortion, and one clinic after another gets closed, and we certainly are in the middle of a time period like that at the moment. But then on the other hand, last year we saw a number of areas where really people did stand up and say this is enough and we need to keep access to abortion care. So I don't know.
And I think at least from what I know of the European situation, things are much more positive in Europe than they are in Texas and other places that trouble me as to what's happening.
Right. But then, of course, there are many parts of the globe where that is not the case. So yes, you might be true that this might be the case
yeah.
for the European situation, but
Yeah.
although not Ireland. I mean.
No, and Central Africa to go
Yeah.
is a real problem
Yeah.
area.
Yeah.
Well, I think we'll invite the students to declare for themselves what they think is happening. This is a controversial issue, so we're going to have to. Everybody has to be respectful of different viewpoints. But it's been wonderful chatting with you on this, Professor Schoen. Thank you very much.